Hi everyone, I am Sharmili Chatterjee, consultant psychologist and special educator. Recently, we celebrated World Health Day on April 7th, 2023. So, basically, I would start explaining what is health. Health is complete well being physically, mentally, emotionally, with an absence of an disease. So, we all know that we can be healthy physically and mentally. So, we all have lot of myths related to mental health, so I thought why not clear it on relating to the World Health Day. So first of all, let's start with the first myth. The first myth is that mental health does not affect me. If we see the statistics, 1 in 5 adults have experienced some kind of mental health disorder. 1 in 6 young people have experienced severe depression or major depressive episode. 1 in 20 individuals have experienced serious mental health disorder, which includes schizophrenia, dissociative identity disorder, personality disorders, etc. Suicide is also one of the leading causes of death in our country, and the age range where people have maximum committed suicide belong to the age 18 to 24. Next is children do not have mental health illness, but it is not true. Children start showing the symptoms at the age, not the age, by the age of 15 to 14 years, 14 to 15 years, and the intensity increases by the age of 24 years. The only problem we have in our country is that we lack in awareness, and maximum of these is not identified, and the children go undiagnosed. So it's very important that we do early intervention and we identify those people as soon as possible, and the intervention is done so that they can move on into their normal life and be at par with their friends and siblings. Next is people with mental health disorders cannot manage any kind of job. It is not true. If, as I said, if the early intervention is done, it is seen that with therapy the productivity increases, they can focus in their job in a better way, there's less absenteeism, their treatment cost is less, because obviously they start going to the physical doctor and they start their treatment there, because they don't see that mental health issue is there. So they start going to the doctors, for cardiologists or gynecologists or any kind of doctors, and general physicians, medicine doctors, and they see that their medicine costs are increasing but their problem is not going. Next is therapy and self-care are waste of time. Why? We should always have only the pills. Pills will help you to cure this mental health illness, but this is not true. If there is a situation where pills are required, pills need to be given, but we always say that pills and therapy go in hand. It is not that we only suggest pills or we only suggest therapy. In such situations where depression, anxiety is very at a higher level, we need to give medicines to the patients. Next is mental health is a sign of weakness. It is never a sign of weakness. Whenever a patient comes to me for therapy or counseling, I just say that you have taken a strong step of coming and identifying your problem. This cannot be a sign of weakness. If a broken arm or a broken leg is not a sign of weakness, then why will a broken heart be a sign of weakness? Next is only people who don't have friends need therapists. We all have suffered with lack of friends, or we have lost some people in our life. That does not mean that they can help us, or they won't be able to help us, or they will be able to help us, because a friend is a person who can judge you, who cannot judge you. They won't give you a proper suggestion. But if you go to a therapist, the person is a professional who deals with such problems on a regular basis. So that person will help you in a better way than a friend. Obviously, you go and ask your friend, but it is not that the friend will only help you and your problems will be solved. Next is psychologists are mind readers. This was the first question when we started studying psychology. This was the first question when the people asked, tell me what am I thinking, but that is not true. Like, I cannot sit with a crystal ball and tell you what are you thinking. Your thoughts are completely open in front of me when you start speaking. I can understand you by the words, by your verbal and non-verbal behavior, but I cannot understand you when you are sitting quietly and doing nothing, and I won't be able to understand you. Psychologists have a perfect life. This is completely a myth. I mean, like, we don't have perfect lives. We are not superheroes. We need to figure out our problems also. There are times when we have lost people in our life. We also go through breakups, divorce, harassments, and all sorts of issues. This also disturbs us, but we know that how to deal with it. But there are times when we also need to go for therapy or medicines for our anxiety and depression. It is not that we have a perfect life or we are superheroes. Next is psychologists are very serious. This is not a complete thing, because this is a profession where everything has to be done very seriously. So we tend to be presenting ourselves in a serious way. I can't, just laugh at my patient who is sitting there, whatever he or she is saying. I have to listen to that person very seriously. I cannot smile I can smile, but I cannot laugh at that jokes, whatever they are saying. I cannot judge that person on the basis of that. People usually judge us that you are very serious, you don't speak to us, you are not talking, you don't smile. That is not the truth. But when I am doing a professional work, then obviously I need to maintain a certain decorum. That is what I am doing. Obviously, when I am meeting with my friends, then obviously I won't be having a serious image. I would be laughing with them. I would be doing everything which a normal persons do. But this is my profession. So I have to follow all the ethical things which this profession gives me. So with this note, I'm ending this video. Have a great day ahead. Thank you. And if you like this video, please like, share and comment. And please subscribe to my channel. With this note, I'm ending. Thank you.